tonight for future roll calls. Okay, proceeding on with action items, changes to the agenda. Russ, would you like to comment on that, please?
Sure, Madam Chair. So we do have a change to the agenda. An item was added, which is item number 3, and that is a petition by Boise State University for an exception to the gathering size restriction of the Ada County orders for the Boise State University football game on Friday, November 6th. And we have some guests from the university on, and I believe that, let me ask Alicia. Alicia, are you planning to make that request for the final 3 home games, or did you want to limit it to this one? Because we'll just need to adjust the agenda accordingly.
Sure, thank you, Russ. We have 3 home games total. So we would like to request that it apply to all 3 remaining home games.
Okay, thank you, Alicia. So, Madam Chair, then when the motion is made to adopt the new agenda, you would need to adopt it for the 3 games versus what is stated on the agenda, which was just for Friday, November 6th.
Alicia, do you have the dates of those games?
Madam Chair?
Yes.
I'd be happy. This is Representative Blanksma for a motion.
Yeah.
Madam Chair, I make a motion that we amend the agenda to what is said, but with the change for the final 3 Boise State home ball games rather than just the game on Friday, November 6th.
Okay, thank you, Megan.
This is Commissioner Hasbrook. I'll second.
Okay, thank you. The motion has been made and seconded to accept this agenda change. Is there any further discussion? Hearing none, I will call for a vote by Ada County.
Jane Young, aye.
Ted Epperly, aye.
Boise County. Elmore County.
Representative aye.
Valley County.
Commissioner Hasbrook, aye.
Okay, thank you, folks. That motion passes for that change to our agenda. Okay, proceeding on under new business. It regards the approval of the minutes from our October 27th board meeting. And I will ask for, if there are no corrections or additions to those minutes, I will ask for a motion for approval.
Madam Chair, this is El.
Yes, El, go ahead.
I'll make that motion to approve those minutes.
Okay, thank you.
This is Jane. I'll second it.
Okay, thank you, Jane. Any further discussion? Hearing none, I will call for a vote by county, starting with Elmore County.
Representative votes aye.
Valley County.
Commissioner Hasbrook, aye.
Boise County is absent. Ada County.
Jane Young, aye.
Ted Epperly, aye.
Okay, thank you, folks. Those minutes have been approved for our October 27th board meeting. Okay, next on our agenda is review of our COVID-19 metrics for criteria for determining quarantine and restriction orders for Ada County by Kim Link, Communicable Disease Control Manager. So, good evening, Kim. The floor is yours.
Good evening, and thank you, Madam Chair. Good evening, everyone. So for this week's summary, we are continuing to see increased numbers of COVID in our community. As we look at the trends, I'll show you in more detail here when we go into the data, but we are seeing an increased trend in the number of ICU admissions among Ada County residents. We did see a slight decrease in the number of Ada County residents who were admitted for non-ICU care over the past 2 weeks. As we look at the disease information, the number of disease reports we received over the past 2 weeks, our numbers did increase. I was not able to, at the time that I finalized this report, I didn't have full data from last week. However, we were able to finalize that data, and there were 1,330 people who were reported as being COVID positive Ada County residents last week. And again, that's an increase from what we had seen the week prior. We are in a position where Ada County is experiencing widespread community transmission. So in addition to the clusters that we're keeping note of, we are in a position where we are seeing high rates of illness throughout the community. It's impacting pretty much any and every sector of people right now. So in terms of specific clusters, one that I want to highlight is our long-term care facilities. We've been seeing over the past couple of weeks the number of facilities experiencing active outbreaks has been climbing again. And as of this past week, we saw that 33 long-term care facilities are having outbreaks at this point in time. Unfortunately, that's an increase from, I believe it was 31 last week. And Justin, if you could go to the next slide. So here's our hospital criteria information, and if you don't have the slide up on the computer, it is titled Hospital Criteria. So you'll see the bar graph on the left-hand side shows the Ada County residents hospitalized for COVID, not in ICU care. We did have a high point in terms of the number of hospitalizations around the 22nd, 23rd of October. Looking at last week, that number of admissions did go down, so we did see a slight decrease in the trend for non-ICU admissions. And if you could go to the next portion of the slide. And for the portion in the middle here, Ada County residents who were hospitalized with COVID and received ICU care, you'll see those numbers are increasing. So we have been in single digits for the number of admissions on a given day, and that number is increasing again. Definitely not the direction that we want to be seeing. And as we look at the graphs on the bottom portion, the one on the left includes our hospitals here in this area in Ada County, their total admissions for non-ICU COVID. And you'll see, we did have a little bit of a drop on the 29th of October. However, our numbers have been steadily increasing. So Ada County residents plus others who are requiring hospitalization for COVID. On the right-hand side, that is the number of patients hospitalized overall in our hospitals receiving ICU care. And again, we are seeing those numbers climbing overall as well. One thing I do want to note, I typically don't pull this information on days that I'm not generating a report, but since it has been a couple of days since I last pulled this information, I did look at where our hospitalizations were sitting for today. I don't have the specific Ada County information, but I did see that there were, our hospitals were reporting 24 patients with COVID in ICU care. And to put that into context, that's about a quarter of our ICU capacity here in Ada County. So we are seeing, I would say, a reasonable number of people being hospitalized right now as a result of COVID. If you could go to the next slide, please. So this slide is the one titled Disease Criteria. And again, as I mentioned, when I pulled this information, we hadn't finalized the data for number of cases being reported last week. So that's why the 1031 numbers are so low. As I said, we had over 1,300 Ada County residents who were reported as having COVID last week. And this is definitely an upward trend in terms of our case counts. Where we're sitting with 1,300, that is rivaling case counts that we were seeing during July and August of last year. Unfortunately, they do continue to rise, and they appear to be rising again this week. If you could go down to the next slide. So this slide, this section of the slide is Ada County information, excluding inmates who are at Department of Correction facilities down in Kuna. What we see is that a lot of the illness that we're seeing still is largely coming out of the community at large. We are seeing some testing coming out of the prison facilities. We are still monitoring active outbreaks going on out there, but much of the illness that we're seeing is based out of the community. And as we look at the bottom graph, again, this is the overall trend information starting from the beginning of the outbreak, from the beginning of the pandemic, week by week. And again, as I mentioned, our case count for last week was 1,330. So again, we're right where we were in July and August of last year in terms of those case counts. If you could go to the next slide, please. So this is a slide that is titled Ada County Case Rate and Emergency Department Syndromic Surveillance Information. The top graph on this slide includes the Ada County 2-week average daily case rate, and this is the rate that we publish for purposes of determining school categories. And this week I published an interim case rate of 35.21. I will be updating this case rate when our public dashboard is published tomorrow on its regular schedule, since we were able to finalize the data from last week. The 2-week case rate that will be included in tomorrow's dashboard is 36.84 cases per 100,000. And I do want to make note that, this is a 2-week rate. We look at the past 14 days. If we just look at last week and the case rate, that is 39.45. So we're sitting at almost 40 cases per 100,000 population right now, which is, in my perspective, an alarming place to be. The next slides down are our emergency department syndromic surveillance information. These are individuals who are presenting to local emergency departments with fever, cough, shortness of breath, and either are not tested for flu or tested negative for flu. These numbers are staying pretty stable at this point in time. So not seeing the same type of trends as we're seeing with overall illness and with hospitalizations. And then the very bottom portion of this graph, again, looks at those trends over the week by week from the beginning of the pandemic. So that's the data. In summary, I do want to reinforce that where we're sitting right now in Ada County and also in Elmore County is that we have widespread community transmission occurring. We're also seeing increases in Boise and Valley counties as well. And here in Ada County, it's pretty clear that the measures that we have in place right now are not sufficient to keep our case counts in check. As I mentioned, we had 1,300 cases reported out last week. We are on track to exceed that for this week, and that may be a new high number of cases being reported among Ada County residents. We had 1 week back in July where we hit 1,500 cases, and I think that it's a definite possibility that we may do that this week. And I'm not sure where the end is in sight for that. As my investigating team is working with the public, what we're advising them right now is to really look at their lives, the things that they're doing outside of their home, and take steps necessary to avoid any unnecessary risks. And to put that plainly, we're asking folks to live a lot more as though there were stay-at-home orders in place, even though we don't have them. Just because our case numbers are so high, we realize that being out in the community right now, there is a risk of COVID. And I also want to bring to your attention, late last week, we reported our first case report of a child being hospitalized due to MIS-C. And this is the multi-system inflammatory syndrome that occurs in children after having a COVID infection. It's a severe illness, it requires hospitalization and can be life-threatening. And unfortunately, this morning I received our second report. In both of these cases, these were kids who had family members who were diagnosed as having COVID. Both kids went into quarantine, they went through monitoring, and neither one reported any signs or symptoms. So they had asymptomatic infection. They finished up their quarantine and went back to life as normal. Unfortunately, about a month after that happened, they had very high fevers and signs of severe inflammation. What happens in these situations is that inflammation can cause damage to different organs. It can cause heart failure, kidney failure. It can be a life-threatening illness. And, thankfully in this case, both received appropriate medical care and do seem to be doing okay. But I think having these two case reports happen in such a short period of time. And in contrast to a lot of our discussion about COVID in kids, where we focus on asymptomatic illness and mild illness and really look at COVID in kids being not that big of a deal from the standpoint of personal health, I think it's a scary reminder that these situations, while they're rare, they do occur, and they are something that we do need to keep in mind. Again, we are continuing to focus our efforts and focus a lot of the work that we're doing on our older population because they do have the highest risk for adverse outcomes. But this isn't something that's completely benign for kids. And with that, that's the end of my report. I'm happy to take questions.
Okay, thank you, Kim. Do we have any questions for Kim?
Madam Chair, this is Ted Epperly. I've got two questions.
Yes, go ahead.
Kim, with the nursing home, skilled nursing facility increase from 31 skilled nursing facilities last week to 33 this week, I just wanted to clarify, are those based on PCR tests, the nasal swab tests, or is this based on the Bionex or Abbott antigen tests in terms of the test positivity for those patients?
Madam Chair, this is Kim.
Yes, Kim, go ahead.
Dr. Epperly, I would have to look at the specific facilities to look at how those are initially being detected. I know that a number of facilities are using antigen testing. However, I believe many of them, especially when they're suspecting a new outbreak within the facility, will confirm that with PCR testing.
Yeah, the only point I want to make on that is especially if the antigen test is being used in asymptomatic patients, there's a fairly high false positivity rate with that. And actually, quite frankly, there can be a reasonably high false negative test rate with that. So if they're asymptomatic patients, the PCR test will probably be more accurate. So the only reason I bring it up, Kim, is just to make sure that it's not a false positive we're counting here. Do you know, were the patients positive in terms of symptoms, or is that just too granular for you to know?
Dr. Epperly, that's something that I would have to look into to get you a more complete answer. My understanding is oftentimes when these outbreaks are first detected, it is through symptomatic individuals, whether that's staff or residents or a combination of both, and then typically mass testing is done of all the residents in the facility.
Okay, thank you, Kim.
Mm-hmm.
Okay, any further questions for Kim?
Madam Chair, this is Ted Epperly one more time. If nobody else is going to say anything, I am obviously greatly troubled by the number increases. Well, I think we all are. The question is what do we do about it in a meaningful way? I wish there were easy answers on this. We're clearly well above our cut point of red for schools at 20, with numbers now at 35, 36, and as Kim said, even high as 39 per 100,000. That's almost double that. And I just wonder, last week, the American Academy of Pediatrics reported that in 1 week alone, we had 61,000 pediatric cases of COVID-19, and many of them were in the Intermountain West. So I just wonder if we don't need to readdress schools, not on this meeting, but do we come up with a different recommendation for schools knowing how intense the outbreak is now as an advisory recommendation to schools? And I would just posit that perhaps we work up something for our next meeting in regards to a further step on schools as an advisory recommendation, and I'll stop with that.
Okay, thank you. Any further questions for Kim? Okay, hearing none. Kim, thank you so much for your presentation. And I do want to announce to the board and the public listening that our Boise County Commissioner, Ryan Sturm, has joined the call. So welcome, Ryan. Moving on to number 3 on the agenda is a petition by Boise State University for an exception to the gathering size restriction for Ada County orders for the Boise State University football games. The next one, soonest one being this Friday, November 6th. This request includes a safety plan for approximately 1,100 students, student-athlete parents, and members of Boise State's band and cheer time to attend the game. This is presented by Alicia Esty, Chief of Staff, Vice President for Compliance, Legal, and Audit for BSU. So, Alicia, welcome, and the floor is yours.
Thank you very much. I appreciate the opportunity to address the board tonight. Again, my name is Alicia Esty, and I'm the VP for Compliance, Legal, Audit, and Public Health at Boise State. I'm joined tonight by our Interim Athletic Director, Bob Carney. We come before you to request an exception to the Ada County Public Health Order limiting gathering sizes to 50 for the November 6th home football game against BYU. And with your approval, Colorado State on the 12th and San Jose State on the 28th. Our exception request extends to 100 to 200 student athletes and staff family members, 500 students, and 275 members of band and cheer. The only other individuals in the stadium will be players, coaches, athletic and operations staff, and members of the media. The university will invite a limited number of guests to the Nickell Sky Center to watch the game. However, we do not require an exception to your order to accommodate these guests. Boise State is mindful of the increasing COVID prevalence rates in the county and takes seriously its responsibility to help mitigate transmission. For this reason, to gain entry into the stadium, attendees will have to present a negative COVID PCR test result from a test administered no more than 72 hours prior to kickoff. As part of the testing process, attendees will also be required to pass a health screening. Because most of the attendees are our students, it benefits us to test them as part of our ongoing surveillance testing program, particularly as they prepare to go home for Thanksgiving break. The university has sufficient testing capacity to test the other attendees to avoid compromising area testing capacity. If approved, the university will divide the stadium into sections, and attendees will have designated entry gates, restrooms, and concession stands to avoid mixing groups and mitigate the possibility of crowding. The university will seat family members together. Student tickets will be distributed in pairs to students who register to attend the game together. Students will be allowed to sit next to their ticket companion, but all groups of students, like others in the stands, will be at least 10 feet away from other groups. All attendees will be required to wear masks in the stadium. The university will ensure that physical distancing requirements are enforced at entry points and throughout the stadium. Our public health staff will be on hand to monitor compliance and address concerns. The university has informed the governor's office of our intention to appear before you tonight with this request, and they've indicated that they will defer to this board's decision on the matter. I will now stand for questions.
Okay, thank you, Alicia. Questions for Alicia?
Madam Chair, El.
Yes, El, go ahead.
Alicia, we're roughly around 1,000 people. Is that correct, if I followed your numbers?
Correct, about 975.
Can you tell me how many people on your staff are going to be in security? And are they counted as part of this 1,000?
They are not counted as part of the 1,000. Bob, do you know how many security staff we'll have on hand?
We'll have about 35 to 40 security staff on hand.
Thank you.
And just for the avoidance of doubt, all of our security staff, everyone who works in the stadium will be tested along with the attendees.
Okay.
Madam Chair, Madam
yes,
Chair, this is Ted Epperly.
Go ahead, Ted.
Yeah, Alicia, thank you for the request. I think, again, we've got to all learn how to live with this. You guys have presented a thoughtful plan of how you'd go about this. My question is at the choke point of the entrance gates in regards to people in line coming in. I know you're going to be proactive with testing people before the game. How how you're going to crowd manage, although I recognize it's nothing like the full stadium, but the lines out front.
Bob, I'll let you take that.
Yeah, so we'll have security gates set up. We'll have TAMIS that will have social distance marking on the floor. We'll use tape for the spacing. And being that we're only going to have 250 people maximum going through a gate, most of our gates are very large, 30, 40 feet wide, and have 8 or 10 entrance gates. We'll have all those gates open and direct people kind of in through those chutes so that we can maintain, the proper social distancing at all time.
Madam Chair, just one follow-up if I can.
Yes, go ahead, Ted.
Another common area, Robert and Alicia, where people can run into trouble in events like this that are in the restrooms. Any thoughts on how you manage the restrooms during the game?
Yeah, we'll have some staff in the restrooms as well. We're also installing plexiglass dividers between urinal stalls. We've met with some of the staff from the Central District Health and walked through our venue. They've looked at our restroom facilities, looked at our concession stands, and we're comfortable with the plan that we put forth to separate spaces, create social distancing, plexiglass on the front of our concession stands, and so forth.
Thank you.
Any further? Yes.
Thanks, Madam Chair. I guess my question is, to get to the Stuckel Center, last I checked, you had to have an elevator, and what are your plans for that?
Yep, that's correct, Representative Blanksma. We will only allow, I believe, 2 people in the elevator per trip, and we'll have a security member standing at the bottom of Stuckel to monitor that, to make sure that we don't have more than 2. And because we'll only have between 40 to 50 people up there, that it's very feasible.
Okay, thank you, Alicia. Any further concerns, questions for Alicia?
Madam Chair, this is Al.
Yes, Al.
So, Alicia, I'm trying to get how we get through this. Is there any way that we could try a game and see how it works, and if we have a major exposure, a major blow up, then we could come back and look at it before we commit to the other 2 games?
Absolutely, and frankly, that's part of the reason for testing people ahead of time, so that we know we're starting with a baseline of all healthy people, and then we certainly intend to follow that group to make sure that we don't see an outbreak. And I'm happy to come back and report those results to you before the subsequent games.
Thank you.
Madam Chair, 2 questions to Russ Duke, if I can.
Yes, go ahead, Ted.
Russ, if I can just mention both questions, and I'll turn it over to you to answer. First, Russ, what does your staff think about all this? What are your thoughts in terms of the recommendation to the board? And second, Russ, do we plan to have anybody attend the game as well and just monitor as a CDH representative and give us a feedback report as well?
Madam Chair, this is Russ.
Yes, Russ, go ahead.
So, Dr. Epperly, we have worked actually very closely with BSU, not just for this event, but for all their school planning and dorms and testing. And, I think they're doing an outstanding job. And understandable, they do have cases on a campus, off-campus students, for example, is, it's in the community. But I guess from my perspective and my staff's perspective, as you've heard from Alicia and Bob, they've done an outstanding job putting a solid plan together. That's a question that I received is, well, what about high school football games? And I realize most of those are done now and we're moved on to winter sports. But I think you've heard this is a totally different, highly managed situation. I'm not sure what the total capacity of the stadium is. Alicia, is it 28 or 30,000?
Right around 35,000 inside the stadium.
Okay, yeah, thanks, Bob. So again, this is just a very small, well-managed crowd that they're talking about with the testing in advance. So bottom line is, I think I think the plan's solid, and I would recommend that the board approve this. And then as far as for subsequent games, Alicia mentioned coming back and reporting to the board. And if it's the board's preference, like we did with Spectra Productions, you could either delegate that to us, where we could continue our ongoing communication that we have, or have her come back or Bob come back and present to the board. I'll whatever your preference is. As far as having a staff person attend a game, absolutely, we can have somebody attend a game and observe like we did for Spectra Productions.
Thanks, Russ. Madam Chair, if I can just follow on to Russ real quick.
Yes, go ahead.
Thanks, Russ. Yeah, I think it'd be wise for us to have an independent agent there as well. Just again, we want to make sure that we do it right. It sounds like BSU is doing it right. We want to do it right. We want to assure the community that in the allowance of activities like this, we're going to do it in a way that continues to keep the public safe. I think that's what builds trust and credibility. We all have to learn to live with this. So, Russ, I think that the approach that you've outlined and that BSU's outlined is certainly in line with us allowing this to happen. I think it will be important to have a report back so that we can make sure that the November 12th and November 28th games can go forward. If there were to be an issue, of course, we'd want to intervene in some positive way.
Madam Chair, this is Representative Blanksma.
Yes, Megan, go ahead.
For a motion.
Yes.
Motion to approve the petition by Boise State University for an exception to the gathering size of Ada County orders for the Boise State University football game on Friday, November 6th, with further approval of football games at the discretion of the director.
I'll second.
Thank you, Megan. The motion has been heard. Is there a second?
This is Elt. I'll second.
Okay, thank you, Elt. Any further discussion before I call for a vote by county? Okay, hearing none, I will ask for a vote by county, starting with Boise County. I don't hear Ryan there. Valley County.
Commissioner Hasbrook, aye.
Elmore County.
Representative Blanksma, aye.
Ada County.
Jane Young, aye.
Ted Epperly, aye. Ted Epperly, aye.
Thank you, folks. Okay, the motion does pass, and I thank Alicia and Bob for their presentation, and we'll look forward to hearing more from you in the future. Thank you.
Thank you. Thank you.
Okay, moving on with our agenda. It's a discussion and vote, potential vote regarding actions for the protect life, health, and safety within the district as to the COVID-19 pandemic, to include potential amendments to current public health orders and additional orders for other counties within Public Health District 4. Russ, would you like to open this discussion, please?
Sure, Madam Chair. So you've heard from Kim what's happening in our communities right now, not just Ada County, but also Valley, Boise, and Elmore. I would say of the three rural counties that we serve, Elmore County is certainly the one that's seeing the most significant, not only number of cases, but case rate. It's very similar to what we're seeing in Ada County at close to 35 per 100,000 per day. So I wanted to make sure this was on the agenda for the board to be able to have a conversation about what some next steps might look like. We do have orders in place for Ada County, as well as a mask requirement for Valley County that's been in place for several months now. So there's that, a discussion for the board and any direction you want to provide to me. And then also I wanted to take this opportunity to discuss some observations we made at some of the bars that were opened through the petition that came to you all that approved opening of specific bars, and then a revision to the orders for all bars within Ada County to be allowed to be open with restrictions. And really what I want to talk about is, what direction would the board like to go in terms of when there's clearly a lack of compliance, and in some instances there's been complaints come to us. We always follow up with the bar owners or whoever's on staff that in charge when we receive complaints. So some of these facilities are operating out of compliance clearly and have been on more than one occasion that we've noted. So however you would like to start, I'll be available to answer any questions or be part of the discussion.
Okay, thank you, Russ. Floor is open for discussion.
Madam Chair, Al.
Yes, Al, go ahead.
Russ, you sent us a list here, I think it was last week, on the number of the bars. A good majority of them are following the guidelines and doing a pretty good job, but there was, maybe 4 or 5 that weren't? Is that the case?
Madam Chair, this is Russ.
Yes, Russ, go ahead.
That's correct, Commissioner Hasbrook. So this was just a spot check. Obviously, we didn't visit all the bars, but we did select ones based on those who were signed the agreement with the attorney David Leroy and myself on behalf of the board, as well as a few others that were part of the original cluster that happened back in June. And there was at least maybe 2 that we also did spot checks on, just based on the complaint volume that we received about them specifically.
Madam Chair, this is Al.
Yes, Al, go ahead.
So Russ, can we go back to their attorney or that group of bars and say, here's the situation? Can you guys police yourselves, or do we need to start talking about shutting the bars back down that are in violation? I don't know how to approach that.
Madam Chair, this is Russ.
Yes, Russ, go ahead.
For sure, Commissioner Hasbrook, we can and we will, and we have communicated to David Leroy in the past when we've had some questions and some concerns brought up. This was the first time we actually went out and did some on-site spot checks. So there are a couple of different options. One could be to send a warning letter to the specific bars that you noted were clearly in violation of the orders, or the agreement, and they're very similar, right? The agreement that we put in place, we mirrored that when we revised the Ada County order. So that could be a first step. Then if it continues to be a problem, we continue to get complaints, there is the option for the board to proceed with closing them, and there is a step that you could have them come before the board and explain to you why they shouldn't be closed. And at that time, of course, we would provide you with the documentation. They would share their story with you, and you could make a decision on that, but you would have the option to close them at that time. And my thought is, as you know, and as you've read, some of the bars are doing a really good job, and that's what we would have expected based on what they submitted with their plans we reviewed and approved, while others are not. I don't think, at least at this point in time, that it wouldn't be my recommendation to close bars as a whole category, but rather focus on the problem areas.
Madam Chair, this is Jane.
Yes, Jane, go ahead.
Russ, are the bars that are in violation owned by the same person?
Madam Chair, this is Russ.
Yes, Russ, go ahead.
Dr. Young, they are not. It's a number of different owners. So I know you probably remember back, there were some owners that owned multiple bars. And interestingly, some of the owners of multiple bars, some of their bars are doing great, and some of their bars are not. So it's not just maybe at that owner level. And I think I don't know what their structure is, if they have managers of the different bars, but that's certainly would need to be part of the conversation too.
Thank you.
Madam Chair, this is Ted Epperly.
Yes, Ted, go ahead.
Yeah, Russ, I resonate with option 1, which is to send a warning letter to those bars that are not complying. I think we owe it to them to do due process. I would also think it very appropriate to send letters to those that are doing a good job and thanking them for that and their attention to detail for the public's health. So I think it could be multi-pronged, appropriate positive letter for those that are doing a good job, and a warning letter for those who are not. And for those who are not, I think it does need to be mentioned that we will check again, and if you're still out of compliance, then closure is an option that this board will consider or act on as is the case, Russ. I think we've got to follow through with bars being closed if they're not in compliance and they've been warned.
Madam Chair, this is Megan.
Go ahead.
Russ, what have you considered perhaps publishing them like you do the food inspections? So here's X violation, the same, am I making sense? The regular publication of the food inspections is what I'm curious about, and if it can just be added to that list.
Madam Chair, this is Russ.
Yes, Russ, go ahead.
Representative Blanksma, we definitely could do that. We don't have, it's not quite as structured as the food inspection process for sure. These were just, we went out, we didn't have, the documentation. We just observed and compared that to the orders in the agreement that is in place. But if the board would like us to publish that information, we'd be glad to do it on our website.
This is Megan again.
Yes, Megan, go ahead.
I do think that if that becomes something that the board is interested, we will want to run it past legal before publish specifics, I guess. I just want to throw that out there.
Madam Chair, this is El.
Yes, El, go ahead.
So my question is for Dr. Epperly. Would you be willing to make that into a motion?
Madam Chair, this is Ted.
Yes, Ted, go ahead.
Yeah, yes, I would. I'll certainly take a first stab at that. Correct me if you guys want to see more to it. I would make a motion that we send a warning letter to known violators, known bar violators of our published order on the protection of the community around their operations. I would also add to the motion that we similarly send a laudatory letter to those bars that are doing a great job. To the second issue of potentially publishing these either on our webpage or other locations, I would agree with Megan that we probably need to make sure legally we're following the right way if we're going to put their name out there. But I would even add that into the motion. The second part of that motion then would be after legal review and appropriate advice to us to get that right. So Elt, if that makes sense, a letter to the known violators that has teeth in it about closure if they're not following Central District Health published orders on this, with a letter to those bars that are doing a good job, and then potentially legal review of known publication of those that are violators. That's the motion.
Madam Chair, this is El.
Yes, El.
I'll second that motion.
Okay, the motion has been made and seconded. Is there any further discussion before taking a vote?
Madam Chair, this is Jane.
Yes, Jane, go ahead.
I would ask that it be fairly specific. So if there are items that they want to correct, they have the opportunity as opposed to broad or generic.
Ted, would you like to respond to that?
Yeah, absolutely. I'd entertain that as a friendly amendment to that. Again, what we want to do is move people towards compliance. And so if in the first warning letter, Russ, if we can let them know what the issues were, and that we will come back and check again to make sure those issues have been corrected before potential closure if they're not. Does that make sense, Russ?
Madam Chair, Russ.
Yes, Russ, go ahead.
Yeah, absolutely. It does, Dr. Epperly. And that's what we do, what Representative Blanksma was referring to with the food inspections. It's very specific as far as, inadequate signage, bar top was open for seating, staff not wearing face coverings, et cetera. And that's something we would definitely do so that they know exactly what the issues are they need to fix.
Madam Chair, this is Representative Blanksma. Yeah, the only comment I would add, I am fine with sending letters that are very specific, as pointed out by Dr. Young, as to what violations in the agreement applied. Sending laudatory letters is pretty subjective, and so I guess if we want to send high fives to people who are doing their job, I think that's fine, but I think that should be at the discretion of the director, since there isn't actually a standard. Whereas when you're talking about bar violations, there are specific standards.
Come on. let's have some positivity in terms of saying to places that are doing a good job, you're doing a good job. Russ, I'm fine with you making a judgment call on if that happens, but let's not just carry a hammer around. Let's also be complimentary to places that are busting their butts to try to do a good job and stay open. I think we ought to be able to say that as well.
Madam Chair, this is Representative Blanksma.
Yes, Megan, go ahead.
This just goes to my point of we need to have standards and structure, and that's what people rely on. And I'm trying to take the arbitrariness out of it. It has nothing to do with telling people they have a good job or not. It's to try to take the arbitrariness out of what is going on. And I've been doing this for months and trying to make this point for months, and I know that it's lost on some, but it's important to me. And that's why I think if we're talking about very specific violations, as pointed out by Dr. Young, outlined in a letter, that is absolutely great. And then if you want to leave laudatory letters at the discretion of the director, that's great too. But I think that it's important that there's very clear structure and standards that people understand. I just continue to believe that we need to focus on that.
Madam Chair, this is Ted.
Yes, Ted, go ahead.
We have a published order. Are they following the order or not? That's as structured as you can possibly get. If they're following the order, let's thank them. Does that make sense?
Okay, hearing no further discussion, Ted, I would ask you if you will repeat the motion as amended once again, please, for the clarity of the board and the audience listening in.
Okay, Madam Chair, I'll give it a shot. The recommendation would be that for bars that are in violation of the published order, that they're given a warning letter with the known violation as to the published order. They're given a period of time to respond positively to that. Central District Health will continue to check on that. And if they're in known repeated violation to that, then they should be closed. I would also offer that if they're in compliance with the published order, very structured, very understood, there are about 8 points to that order, then they should be thanked for their compliance. That would be the motion that I would make, and I'll just stop with that as the motion.
Okay, thank you. Is there a second to the amended motion?
This is I'll second the motion.
Okay, thank you. Any further discussion before we take a vote by county?
Madam Chair, this is El.
Yes, El, go ahead.
I really like the positivity part of this, because if we end up putting these guys on a website or in a local paper or something, rating them, I think that's going to help their business succeed even better if the public knows that, hey, this is a safe bar to go to. They've gotten a gold star from the health district or whatever you want to call it. And I don't see why it would be too difficult to do.
Okay, thank you, Elt. Any further discussion? Okay, I will call for vote on the motion, starting with Elmore County.
Representative Blanksma, aye.
Valley County.
Commissioner Hasbrook, aye.
Boise County, are you on? don't hear Ryan. Ada County?
Jane Young, aye.
Ted Epperly, aye.
Okay, thank you, folks. The motion does pass.
Commissioner Sturm, aye.
Oh, hi, Ryan. Thank you. Thank you.
Yes, I've been here the whole time.
Oh, have you? Okay. We couldn't hear you, or at least I couldn't.
No, you're fine. You're fine. I had it on mute. I'm dealing with about 3 things at once. But yes, I've been listening.
Okay, good. Great. Russ, do we have anything else under agenda item number 4 that you need to address before we move on?
Madam Chair, I guess just more of a conversation point. We addressed the specific issues with bars, but given the fact that the cases are rising at a pretty rapid rate, as Dr. Epperly pointed out, when we look at 20 cases per 100,000 per day as moving into the red category for the purposes of guiding schools, and we're nearly double that in Ada County, as well as it's heading in that direction in Elmore County. I think we're going to really need to give consideration for what this might look like in a week or 2 from now. Is the board interested in possibly modifying orders in Ada County to impose further restrictions? Also consideration for Elmore County at some point if the case counts continue to rise. And the thing I guess I'm really keeping my eye on, and I'm sure you are as well, is the impact to the hospitals. We heard from them at the last board meeting, and they were very concerned looking at that 3 to 4 week time period is what I recall, where they're going to have a difficult time providing the care that they need to provide to the community. So I think we need to be prepared for that to happen if we don't take any steps. Or at what point in time does the board wish to take further steps? And I'll stand by for guidance on that. But we're in a situation. I know a lot of people talked early on about this being no different than flu, but if you look at the average number of flu deaths in the state of Idaho, is about 25, with a really bad flu season being in 2017 and 2018, crossing over that winter time period. It was 101. In our district alone, we have 188 COVID-related deaths, and that continues to the count just goes up as the days go by. So it is a very serious disease. Fortunately, it's not what it was, not what we thought it was coming out of China and some of the initial reports, but here in the United States, in Seattle and New York, but clearly it's far worse than what we've ever seen with the flu, and we have no vaccine at this point in time, and the only means we have to put in place to slow the spread are the community mitigation strategies that we talked about, like face coverings and physical distancing and some of the orders of closure or gathering size restrictions. So I just want to put that out there. Don't need to make a decision tonight, but if the cases continue to rise and the hospitals get impacted like they said they had predicted they would, then I think we need to be thoughtful and think about what actions we want to take next.
Madam Chair, this is Representative Blanksmith.
Go ahead.
Thank you, Madam Chair. I think that's great to be aware. I think it's important that what we're looking at are recommendations from the director and his staff, because I can guarantee that not one of us is an epidemiologist. We all have our specialties, but that isn't one of them. And so, I mean, we've had this discussion round and round and round, and I think we all understand what the risks are and what we're getting into. But I think that if we're talking about making decisions, then I think it's important that the director bring the recommendation to the board and that it's a recommendation to vote upon rather than the opposite direction.
Madam Chair, this is El.
Yes, El, go ahead.
Question for Russ. I'm trying to remember the last time we got together. Didn't we give you some directions to go talk to the Elmore County commissioners and the mayors and see how they felt about a mask mandate in Elmore County, and did that happen?
Madam Chair, this is Russ.
Yes, Russ, go ahead.
Commissioner Hasbrook, I did talk to the mayors of Mountain Home and Glens Ferry, which are the two larger cities, and that's what I was looking at as far as a recommendation for face covering requirement would be within those two cities specifically, not the entire county. And I also talked with the 3 Elmore County commissioners about the idea. I think I would describe it as very split on whether or not they would support a mask order, even as limited as for indoor only public places within the city limits of Glens Ferry and Mountain Home. So, part of that discussion was, if we don't do it now, at what point would it be acceptable? Or, I guess at what point would it be acceptable for Central District Health to issue an order for Elmore County for those specific cities? And, that's a conversation that'll need to be ongoing, but I think we all know that there's tents set up in the parking lot in Elmore Medical Center to just provide basic care for stroke, trauma, heart attack. I think that's probably too far. And I think we all can agree with that. So somehow we're going to have to dial it in and figure out what the right time is, assuming we may get to that point.
Chair, this is Elt again.
Yes, Elt, go ahead.
And I think the other thing that we need to start talking about, because I know we did it a month or so ago, about group size, and we talked about going down to 20 or 25, and maybe we need to start thinking about that as well for some of these harder hit areas. I don't know how else to slow it down, but we got to do something, because what we're doing now isn't working.
Madam Chair, this is Jane.
Yes, Jane, go ahead.
I'm curious as to how, when
I lost Jane.
Jane, you froze up. Betty Ann, this is Ted. I think we've lost her, but she'll probably dial back in.
I think so. Okay.
Betty Ann, this is Ted. If I can just add on a couple things here too.
Sure. Go ahead.
So Russ, with the conversation we're having now about kind of the next steps in the game plan, if you and your staff come back with some recommendations along the lines again of, is there an advisory recommendation that you think we ought to make to schools? And also the recommendation potentially for face masks in Elmore County as well, now that you've talked with them. I think we do need to entertain that, and your staff's recommendation to us as a board to act on. Also, Russ, we had mentioned at the last meeting, if there are any additional items educationally we can offer to the community to just help with engagement on the community's part, that'll be helpful. Because again, what individuals can do for this probably will make the biggest difference. And then lastly, Russ, on this is and I know that you and your staff are probably working towards this, but some holiday recommendations for Thanksgiving, Christmas, and New Year's, just so that we can put that out to the community as just a set of recommendations from Central District Health, not mandates, but just some advice on what families can do to help do their best to avoid potential infection. Thanks.
Okay, thank you. Jane, are you back on? I'm not hearing Jane. At this point in our agenda, we're down to adjournment. Russ, correct me if I'm wrong. Our next meeting is scheduled for November 17th at 5:15 p.m. Am I correct?
Madam Chair, you are correct. It would be Tuesday at 5:15 would be the plan, and we had canceled the meeting on the 10th.
Okay, thank you. Hearing that, I will go to the board for a motion for adjournment.
Madam Chairman?
I'm sorry, I got some muffled conversation.
Madam Chair, this is Representative Blanca.
Yes, go ahead, Megan.
I don't want to lose my streak, so motion to adjourn.
Okay,
Madam Chair, this is Commissioner Sturm. I second. I don't want to lose my streak either.
thank you, Ryan. Any further discussion before I call for a vote for adjournment? Okay, hearing none, I will ask for a vote by county, starting with Ada County.
Jane Young, aye.
Ted Epperly, aye.
Boise County.
Commissioner Sturm, aye.
Elmore County.
Representative Langsma, aye.
Valley County.
Mr. Husband, aye.
Okay, the meeting does stand adjourned, and I thank the board for their participation and also for the public who is listening in during these challenging times. And I just wish everybody a good evening now.
Take care. Be safe, everyone.